My name is Kelsey Caton. I am an analyst in the Data Sciences Division at the City of Houston Health Department. In this video, I'm going to discuss how we use wastewater monitoring data alongside other types of data to inform jurisdictional level decision-making for the City of Houston. Please see companion videos describing the statistical interpretation of the wastewater data and how we use the wastewater monitoring data alongside other types of data to inform targeted zip code level public health interventions. In this video, we will go over an example of a report that incorporates wastewater data with other important COVID-19 data sources. The HHD COVID-19 Ramp-Up Metrics Weekly Report provides the Houston Health Department leadership with updated key surveillance indicators for the city as a whole to help support continued COVID-19 monitoring efforts. We are lucky at HHD to have access to multiple internal and external data sources, some from already established systems and other sources created during the pandemic that have provided and continue to provide timely data to our staff and, in turn, information to our community. Monitoring the various trends in these data sources can provide a more complete picture of the state of COVID-19 in the community, with wastewater providing an indication on COVID exposure risk and the more clinical data providing insight into the health impacts of COVID. Here is the main table, which is included in the COVID-19 Ramp-Up Metrics weekly report sent to internal HHD leadership that displays final outputs from all the data sources utilized to monitor COVID. This table was adapted from the LA County Early Signals dashboard and modified to include similar variables that were available here in our jurisdiction. The key indicators are listed on the left. We keep track of these 8 indicators on a weekly basis. The first 2 listed are wastewater related, followed by the emergency department indicator, 2 clinical testing, and 2 hospital bed usage indicators, and finally the school outbreak indicator. The next column shows the established number of days the indicator lags behind wastewater levels, if available. These values were determined by a separate correlation analysis. For example, we estimated that the 7-day centered average percent of emergency department encounters with a diagnosis of COVID lags about 4 days behind the wastewater data. For more detailed information about how this analysis was conducted, please see the article linked with this video. The next 3 columns give the threshold values that divide levels of concern into low, medium, and high. I will discuss how each of these is calculated for each indicator as we move along. The next column gives the current value for each indicator with an arrow indicating the direction of change from last week's value. These current values are colored by the corresponding level of concern. The final column shows the date of when data was updated for the indicator, along with the date range used for the 7-day centered average. For each week, we try to use the most current data possible. However, different data sources are updated on varying schedules. For example, wastewater sampling for Houston generally occurs on Mondays. The wastewater data is not finalized for Monday sampling until later in the week on Fridays. Therefore, wastewater data presented in the current report is from the previous Monday's sampling. Hospital bed usage data is from an external source, and updates are not controlled by us here at the Health Department. Generally, this data is updated once a week. For data coming into HHD's internal surveillance system, including positivity and emergency department visits, data is updated and can be outputted on the day of the report. Again, we use the most updated data available for each indicator when updating this report. Now I will go through each indicator in more detail. We will start with the first two indicators listed, the percent of the population in the wastewater treatment plants with an increasing trend, and the weekly increase in the percent of population in wastewater treatment plants with an increasing trend. Here is the underlying formula for the first threshold indicator, the percent of population in wastewater treatment plants with increasing trend. Take the population of the wastewater treatment plants with an increasing trend for that week and divide by the total population in all wastewater treatment plants, then multiply by 100. Here is an example from a week in April 2022. At this time, there were 12 wastewater treatment plants with an increasing trend. These 12 wastewater treatment plants correspond to 50.3% of the total population. Therefore, the indicator for that week for percent of population in wastewater treatment plants with increasing trend was 50.3%. Here is the underlying formula for the second threshold indicator, the weekly increase in percent of population in wastewater treatment plants with increasing trend. You take the percent of population in wastewater treatment plants with increasing trend from this week and subtract from it the percent of population in wastewater treatment plants with increasing trend from the week prior. Here is an example taking the same week as the previous slide, when the percent of the population in wastewater treatment plants with increasing trend was 50.3%. The week before, the percent of population in wastewater treatment plants with increasing trend was 33.1%. Therefore, the weekly increase in percent of population in wastewater treatment plant with increasing trend indicator for this week is 17.2%. When the difference is negative, the weekly increase in percent of population in wastewater treatment plant with increasing trend indicator is set to 0%. The thresholds for the wastewater indicators were set by looking at the three prior historical waves. In this case, it was the Alpha, Delta, and Omicron waves. We reviewed the wastewater indicators during these waves to set thresholds that would reflect when the concerns were low, medium, and high during those waves. Let's now look at the third indicator, the centered 7-day average percent of emergency department encounters classified as COVID-related. HHD houses a local version of the syndromic surveillance system ESSENCE, which stands for Electronic Surveillance System for the Early Notification of Community-Based Epidemics. For more information about ESSENCE and syndromic surveillance, please see the link provided with this video to CDC's National Syndromic Surveillance Program, or NSSP website. Healthcare facilities across the Texas Public Health Region 6-5 South report their daily facility visit data to our system. The data are at an individual visit level and de-identified. Using Microsoft SQL Server Management Studio, we query the latest data by discharge diagnosis containing a COVID-19 related ICD code. We also subset the data to only include emergency-related visits. To get the centered 7-day average for a given date, the number of emergency department visits with a COVID discharge diagnosis is summed from 3 days prior to 3 days post and divided by the total number of emergency department visits for the same time period, and then multiplied by 100. The level of concern thresholds are calculated using historical data from September 2020 to March 2022. The daily centered 7-day averages for this time period were ordered and then divided into thirds. The values that split these data into thirds, the tertiles, are the cutoffs used for the low, medium, and high levels of concern. Let's go over a quick example in the next slide. For this example, let's calculate the indicator value for October 1st, 2022 with the given table of data on the right. From the previous given formula, we will use daily data from Essence from September 28th to October 4th to get the centered 7-day average percent of emergency department encounters classified as COVID-related. We sum the COVID emergency visits and divide by the sum of the total number of emergency visits for this date range and then multiply by 100. This calculation results in an indicator value of 0.51%. Comparing to the previously given threshold levels, we see that 0.51% is less than 2%. Therefore, for October 1st, this indicator using emergency department data would be at a low concern level. Let's now look at the fourth and fifth indicators listed in this table. The centered 7-day average positivity rate for the entire City of Houston jurisdiction and the centered 7-day average positivity rate for the low-income areas of Houston. HHD's internal Houston Electronic Disease Surveillance System, or HEDS, receives clinical and laboratory data, usually in the form of ELRs, from onboarded hospitals, clinics, and labs. HEDS is a surveillance and outbreak response system that was already established pre-pandemic and was used extensively in COVID contact tracing efforts. Currently, through the efforts of various internal data teams, a daily data file in COVID-19 PCR lab results is outputted from the system and used as the source for the positivity rate calculations. Using the statistical software SAS, the data is clean, filtered to only include individuals living in the 105 City of Houston associated zip codes, and manipulated to get the aggregated number of people who tested positive for COVID and the number of people who were tested for COVID in a day. Similar to the emergency department indicator, to get the centered 7-day average positivity rate for a given date, the number of people who had a positive COVID PCR test is summed from 3 days prior to 3 days post and divided by the total number of people who had a COVID PCR test for the same time period. This is then multiplied by 100. The level of concern thresholds are calculated using historical data from September 2020 to March 2022. Tertiles based on the daily centered 7-day averages for this time period were calculated and used as cutoffs for the 3 concern levels. We'll go over another example in the next slide. In this example, let's calculate the City of Houston positivity rate indicator value for October 1st, 2022, with the given table of data on the right. From the previous given formula, we will use data from the HEDS output after aggregation to the daily level from September 28th to October 4th to get the centered 7-day COVID-19 positivity rate for the City of Houston. We sum the number of positive individuals and divide by the sum of the number of tested individuals for this date range and multiply by 100. This calculation results in an indicator value of 6.57%. Comparing to the tertile threshold levels, we see that 6.5% is between 6% and 11%. Therefore, for October 1st, this indicator using the clinical testing data from HEDS would be at a medium concern level. I will briefly go over the fifth indicator here, the centered 7-day average COVID-19 positivity rate for the lowest income areas. The main data source and calculations are the same as the previous City of Houston positivity rate indicator with just a smaller subset of the data. To subset to the low-income zip codes of our jurisdiction, we use the COVID-19 Community Vulnerability Index, or CCVI. More information on the CCVI methodology can be attained from the Sergo Ventures Precision for COVID website. We have included a link with this video. For this indicator, we specifically use the CCVI Theme 1, which incorporates various socioeconomic status variables, including poverty, unemployment, income, education, and insurance. The higher the calculated index number, the more vulnerable the community. To subset our data for this indicator, we only include data for individuals who live in one of the top 2 quartile zip codes for this CCVI Theme 1. As far as concern levels for this indicator, we decided to use the same threshold values as the previous indicator for the positivity rate for the city as a whole. Using these cutoffs, we can compare how the low-income areas of Houston are doing with the city as a whole. Please refer to the previous indicator for an example calculation. Let's now look at the 6th and 7th hospital bed-related indicators listed in this table. The centered 7-day average percent of general beds occupied by patients with COVID and the centered 7-day average percent of ICU beds occupied by patients with COVID. Both hospital bed usage indicators are from an external data source from the Southeast Texas Regional Advisory Council, or SETRAC, that collects data from reporting hospitals in the region. A link to their dashboard is provided with this video. The data from this source is aggregated to a county level. The City of Houston mainly resides in Harris County, so we filter data to this county when updating these indicators. We manually retrieve daily values for the number of general beds occupied by patients with COVID-19 and the number of general beds occupied from the dashboard site each week to the most current data available. Again, similar to previous indicators, to get the centered 7-day percent of general hospital beds occupied by patients with COVID, the number of general hospital beds occupied by patients with COVID is summed from 3 days prior to 3 days post and divided by the total number of general beds occupied for the same time period and multiplied by 100. The level of concern thresholds here are also calculated using historical data from September 2020 to March 2022. Tertiles based on the daily centered 7-day averages for this time period were calculated and used as cutoffs for the 3 concern levels. We'll go over an example of the calculation in the next slide. In this example, let's calculate the general hospital bed indicator value for October 1st, 2022 with the given table of data on the right. From the given formula, we will use daily data from the SETRAC dashboard for Harris County from September 28th to October 4th to get the centered 7-day average percent of general hospital beds occupied by patients with COVID. We sum the number of general beds occupied by patients with COVID and divide by the sum of the general beds occupied for this date range and multiply by 100. This calculation results in an indicator value of 5.83%. Comparing to the previously given threshold levels, we see that 5.83% is less than 6%. Therefore, for October 1st, this indicator using general hospital bed data is at a low concern level. Briefly, the ICU hospital bed indicator data source and calculations are the same as for the previous general hospital bed indicator. Please refer to the previous indicator for an example calculation. Finally, we'll go over the 8th indicator listed here, the number of new outbreaks in K-12 schools in the past 14 days. HHD, in partnership with local school districts, has developed a biweekly COVID-19 testing program that encompasses almost 350 K-12 schools in the area. An outbreak is defined as 2 or more laboratory-confirmed COVID-19 cases with onsets within a 14-day period and do not share a household within a school site. The concern level thresholds are defined differently than previous indicators. For the low concern level cutoff, if outbreaks occur in less than or equal to 4 schools, or roughly less than 1% of the school sites participating in the testing program, then the indicator is considered at a low level of concern. Similarly, if outbreaks occur in 1.5 to 3% of schools, that is 5 to 10 of the participating schools, then the level of concern is at a medium. Now that we've gone over in detail the 8 indicators, let's look at a few more figures included in this report. This heat map is updated weekly as well to keep track through time how indicators change through the levels of concern. The colors green, yellow, and red correspond to the concern levels of low, medium, and high, respectively. We also include a time series figure for some of the indicators in the report. Here you see the wastewater data with the centered 7-day averages for the City of Houston positivity rate, the percent of emergency department visits with COVID, the percent of general beds and ICU beds occupied with COVID-19 patients. This figure gives some perspective of how current values compare to those in previous waves of Alpha, Delta, and Omicron. For example, in the most recent wave seen on the right, starting roughly in May of 2022, both Houston's wastewater and positivity rate shot up to close to previous wave values. However, we do not see the same levels for the emergency department and hospital bed data. This may indicate that for this past wave, we may have had a lot of COVID exposure risk, but we did not experience the same health impacts as in previous waves. We also like to keep an eye on testing numbers, as seen in the bottom part of the figure. As you can see recently, the number of tests being reported are quite low compared to testing numbers in previous waves.